The regulation of food supplements differs from country to country, although the Codex Alimentarius has provided some general rules. According to the law in the European Union, food supplements means, now comes a quotation, foodstuffs, the purpose of which is to supplement the normal diet and which are concentrated sources of nutrients or other substances with a nutritional or physiological effect, alone or in combination, marketed in dose form. End of the quotation. Presently, there is in the EU a list of mineral and vitamin compounds and other substances that may be used in supplements, but there are no maximum values given for vitamins and minerals. Substances not listed may also not be used in food supplements. The manufacturer is responsible for the safety of his products. In order, however, to control the safety of supplements and their compliance with laws on food labeling, including claims on suitability and effects, many countries have established registration procedures.
Smoking and alcoholic drinks are widely used in our societies, and also pregnant women are exposed oftentimes. However, in pregnancy, smoking and alcohol induce adverse effects not only in the mother but also in the unborn child. Therefore, clearly it's safest to completely avoid smoking and alcohol both before and during pregnancy. Medications sometimes are required also in pregnancy, but if drugs are used, it's important to choose consciously and to choose a medication that has no untoward effects on the fetus. And even certain foods can induce adverse health effects for the mother and, more importantly, for the fetus. Therefore, in this unit, we will explore which choices pregnant women should aim to restrict or even to completely avoid. Of alcohol during pregnancy is associated with fetal alcohol syndrome and fetal alcohol spectrum disorders. Fetal alcohol syndrome was first described only in 1973. It is characterized by restricted fetal and postnatal growth, certain congenital anomalies, facial dysmorphia, and neurodevelopmental delay. Current evidence does not allow to define a safe and risk-free amount of alcohol consumption or a safe time window during which the effects would be negligible. Human intervention studies on the dose and effect relationship and on the critical time windows cannot be performed for ethical reasons. Therefore, most guidelines recommend that pregnant women should completely abstain from alcohol consumption. However, this advice can induce uncertainty and feelings of guilt among those women who consumed alcohol very early in pregnancy before they even realized that they had become pregnant. The 2010 guidelines of the UK National Institute for Health and Care Excellence, or NICE, recommend abstinence in the first trimester but state if women choose to drink after that, a maximum intake of 1 to 2 units a week should not be exceeded. This is because some large cohort studies failed to show effects of low to moderate alcohol consumption during pregnancy on a number of outcomes, such as neurodevelopmental delay, children's IQ, preterm births, low birth weight, intrauterine growth retardation when compared to alcohol abstinence. Binge drinking during pregnancy has been clearly associated with neurodevelopmental delay and neuropsychosocial impairment in the offspring. Women often find it very difficult to stay away from cigarette smoke because they might be exposed to it passively, or because it is an addiction which is harder to quit than occasional alcohol consumption. The prevalence of tobacco smoke exposure and tobacco dependence among women of childbearing age has increased in the second half of the 20th century. The adverse consequences have become well recognized. Smoking can increase the risk for preterm birth and miscarriage, birth defects, early placental abruption, low birth weight, and it also increases the risks of allergy and obesity. Moreover, maternal smoking in pregnancy increases the child's risk for the sudden infant death syndrome or crib death. Also, the occurrence of some congenital malformations is increased, such as orofacial clefts, limb reduction defects, clubfoot, eye defects, gastroschisis, and abdominal hernias. Smoking cessation should ideally happen before gestation, but in women who continue to smoke, cessation during pregnancy is also strongly recommended. Using nicotine replacement therapy during pregnancy is a controversial topic. So if a woman considers her only chance to stop smoking is to use nicotine replacement therapy, it might be worthwhile to try if it eventually helps this woman to stop smoking. However, nicotine replacement therapy should only be used after consultation with a physician, obstetrician, or pharmacist. Pregnant women should not smoke and should avoid passive smoking. Gynecologists, midwives, and other healthcare professionals should explicitly address pregnant women and their partners about smoking and should motivate them to quit and advise them that pregnancy is a very good opportunity to stop smoking. Unlike alcohol and tobacco, the use of medications cannot always be avoided. Pregnant women often are unsure about continuing a medication established prior to pregnancy or to take a new drug. Risks and benefits of any medication for both mother and the unborn child must be carefully explored before making a decision on the use of a certain medication. Alcohol, cigarette smoke, and the use of certain medications might be the most obvious lifestyle choices to avoid when being pregnant. However, there are also some food products which should be restricted due to their potential of causing adverse health outcomes. Professor Hildegard Schrembel is an expert in this field and will give you advice on which potentially harmful foods and food components to restrict during pregnancy.
Caffeine is an alkaloid found in various plant constituents. Best known are coffee and cocoa beans, tea leaves, guarana berries, and the kola nut. And it is an ingredient which is added to a variety of foods, particularly cola-type beverages and so-called energy drinks. The European Food Safety Authority has assessed recently the safety of caffeine for the general population. It has concluded that an acute intake of 3 mg of caffeine per kilogram body mass and also a daily intake of about 5.7 mg caffeine per kilogram body mass is of no concern in non-pregnant women. For pregnant women, however, in whom the half-time of caffeine disappearance from the blood increases 3 to 4 times during the course of pregnancy, EFSA concluded that a habitual intake of 200 mg caffeine per day does not give rise to safety concerns with regard to potential adverse effects on the offspring. These adverse effects might be fetal growth retardation or small for gestational age. The same daily dose appears to be safe for breastfed infants when the mother consumes this amount of caffeine. Depending on the strength of the coffee and the size of cups, this corresponds to about 3 cups per day.
So in conclusion, the consumption of certain foods should be restricted during pregnancy in order to avoid untoward effects on the unborn child. Historically, infectious diseases have been a major cause of maternal and fetal morbidity and mortality worldwide. Although improvements have been achieved due to better hygienic standards and vaccinations, infections still continue to represent a major public health problems during pregnancy until today. One cause are foodborne infections that can induce infection in both the mother and the unborn child and can induce miscarriage, premature labor, severe congenital disease, and even fetal death. Therefore, it is important that pregnant women take precautionary measures to reduce the risk of foodborne infections by selecting appropriate foods and by introducing proper food handling. Prevention is the main focus in the management of foodborne diseases during pregnancy. There are three major groups of pathogens that pose the greatest threat of causes of foodborne illnesses to a pregnant woman and her child. These include Listeria, Salmonella, and Toxoplasmosis. Listeriosis, caused by the bacteria Listeria monocytogenes, is a predominantly foodborne illness. Listeria can contaminate a variety of raw foods, such as uncooked vegetables and meats, unpasteurized milk, and soft cheeses. Research suggests that pregnant women seem to be more susceptible to Listeria infection than the general population, although the infection itself does not appear to be more severe. However, Listeria tend to invade the placenta and the fetus, and they may cause severe fetal and neonatal infection. Fetal infection can lead to preterm labor, neonatal sepsis, meningitis, and death. Evidence has shown that in 1 in 5, or about 20% of pregnancies complicated by Listeria infection, resulted in spontaneous abortion or stillbirth. Prevention of foodborne Listeria infection during pregnancy is a key priority. All pregnant women should be informed during their normal prenatal care about proper food preparation practices and about avoiding foods with a high risk of contamination. The 4 cornerstones of safe food preparation should be followed, which include clean, separate, cook, and chill. High-risk foods should be avoided. This includes in particular raw and not fully cooked meat, raw sausage such as salami, raw ham, and other raw animal foods. Only meat that is thoroughly cooked is really safe. Also, soft cheese, smoked fish, and prepared and pre-packed salads should be avoided. Fresh foods, vegetables, and salad must be thoroughly washed, freshly prepared, and soon consumed. Thereby, the risk of Listeria infections can be greatly minimized. Infections caused by Salmonella species are the most common cause of foodborne diseases. In the United States, the CDC estimates that 1.2 million cases of illness are caused by non-typhoidal Salmonella every year in the US alone. Salmonella is often contracted through contaminated food. Pregnant women are no more susceptible to Salmonella than the general population, but there are specific complications that are associated with the infection during pregnancy. Septic infection in the mother can result in spontaneous abortion. If transmission to the fetus occurs, this can cause preterm birth and neonatal infection of the brain and meningitis. Again, prevention is important to avoid foodborne Salmonella infection. The most common sources of Salmonella are foods of animal origin. Pregnant women should avoid raw or undercooked eggs, poultry, and meats. Many foods contain raw eggs of which people are not often aware. These can include Hollandaise sauce made at home or in some restaurants, mayonnaise, Caesar and other salad dressings made at home or in some restaurants, tiramisu, homemade ice cream, cookie dough, and frostings. All of these products and other foods containing raw eggs should be strictly avoided by pregnant women to reduce the risk of Salmonella infection. It is important to adhere to proper hygiene precautions when handling raw meat or poultry. These include washing hands, work surfaces, and utensils immediately after contact. Toxoplasmosis is the third major cause of foodborne disease deaths in the world. It is caused by the intracellular parasite Toxoplasma gondii. Transmission to the fetus can occur. The overall risk of developing congenital toxoplasmosis ranges from 20 to 50% of untreated infected pregnant women. Maternal infections in later stages of the pregnancy are more likely to be transmitted. Toxoplasmosis vertical transmission increases from 10 to 15% in the first trimester to 44% in the second trimester and to more than 71% when the maternal infection occurs in the third trimester. At the same time, maternal disease severity actually decreases with gestational age. This means that there's a higher chance of pregnancy loss and severe sequelae when infection occurs in the first trimester. While congenital toxoplasmosis is rare, when it does occur, infection of the unborn child can have devastating neurological and ophthalmological consequences, and it can induce cardiac malformation. That is why prevention of toxoplasmosis infection should be at the forefront of pregnancy care. In all cases, the screening policy and information on prevention of Toxoplasma gondii infection should be made available to all pregnant women and women in the preconception phase. As with all other foodborne disease, prevention can be carried out with specific hygienic and dietary recommendations. Examples of such have already been given for avoidance of listeriosis and salmonellosis. Cats have been identified as additional important transmitters of Toxoplasma gondii. Therefore, there are additional recommendations on contact with cats during pregnancy. These include wearing gloves and thoroughly cleaning hands and nails when handling material potentially contaminated by cat feces, such as sand or soil, or after working in the garden. Change litter and get rid of cat feces with wearing gloves on a regular basis, usually every 24 hours. It is even better if the pregnant woman can get another family member to do this. Disinfect emptied cat litter tray with near boiling water for 5 minutes before refilling. Freeze meat to at least -20 degrees Celsius or -4 degrees Fahrenheit, which kills Toxoplasma gondii cysts. In all the 3 instances of the foodborne diseases that we discussed, awareness of the causes of infection by foodborne illnesses is the best means of preventing infection. Therefore, healthcare professionals need to adequately inform pregnant women of these potential risks and how to avoid them during their first consultation.